Hi, everybody. Welcome to the Mass Retirees Weekly Update. Today's Friday, January 15th. Thank you so much for joining with us again this week. I'm Sean Duhamel from Mass Retirees. Joining me is our insurance coordinator, Cheryl Stillman, who is no stranger to our members. One of the things we want to do going forward with these weekly updates is provide you, our members, with valuable information on the types of services and savings that can be generated, not just by mass retirees, but also properly utilizing your benefits. So whether you are a state retiree or a local retiree who's insured through the State Group Insurance Commission, or if you're receiving your healthcare coverage from the city or town in which you retired from, and in many cases you would be insured through Blue Cross Blue Shield, there are a lot of programs and benefits built into your insurance, your health insurance product, that are going to enable you to save money. And what I'm referring to are things like diabetic supplies, durable medical equipment, eye vision benefits, telehealth, these sorts of things that we're involved in, day out, that a lot of folks either simply don't know exist or are overlooked. So again, joining me today is Cheryl Stillman. She is our insurance coordinator. She's a retiree from the Group Insurance Commission. She worked 30 plus years for the GIC. She is an expert on everything healthcare related, not just with the GIC, but also with Blue Cross Blue Shield and Harvard Pilgrim and Tufts and the other insurance companies that we work with. And before we jump into this today, just let me remind everybody that a key benefit that you receive as being a member of Mass Retirees is that if you have a problem with your insurance coverage, you have folks to turn to help you straighten that out. So whether it's calling me on a healthcare policy issue, or Nancy McGovern, or Bill Reary, or Frank Valeri, or calling Cheryl to help you resolve an insurance claims problem, we're here for you. And we're going to be able to help you cut through that red tape. Cheryl does a masterful job of bringing our members together with the either GIC officials or Blue Cross officials or Unicare officials, CVS, and straightening all these things out behind the scenes. And if she were a professional baseball player, Cheryl, you'd be in the Hall of Fame with your batting average of fixing members' problems. But it's really a very important service that we provide for our members. So before we jump into things, I just want to point that out and thank Cheryl for the job that she does day in and day out of working directly with our members to resolve these problems. And the idea for today's topic really came from Cheryl. She gets these types of calls all the time. She's hearing from members looking for ways to save some money or not really being sure where to turn or exactly how the benefits work. So we want to take this opportunity to explain this a little bit in further detail. And if you have any questions after watching today's video or reading the email that we're going to send out along with it, give us a call. If you are a Mass Retirees member, you have our direct contact information on the back of your membership card. So if you can't reach us in the office, call Cheryl at home, call me at home. You have our direct information. We're always here to help you walk through these issues and straighten it out. But Cheryl, let's jump into things. I know we get a lot of calls about, let's say, durable medical equipment and diabetic supplies and those sorts of things. And can you give some examples of what we're talking about when we say durable medical equipment?
Absolutely. Hi, everybody. Sean, I'll pay you the 50 after we talk. Whether you are on Medicare health insurance or non-Medicare health insurance, there are many discounts that our members do not know about. Either you get a cost savings, or sometimes it's even a free savings. I will tell you about some of our health insurance benefits right now that you can get. First of all, on diabetic supplies, there are two different companies. One company is for non-Medicare retirees, and it's called McKesson, I'm sorry. The number is 1-800-422-0280. You call them up. Anybody who's not on Medicare can get diabetic supplies from them, sometimes at a small cost, sometimes free. Then people who are on Medicare, the company is called US Med. The number is 877-840-8218. Again, I'll repeat the number for you people. 877-840-8218. I have gotten many calls from people thanking me for the service. Also, there are other services. As a matter of fact, there is a wonderful service called IMED. If the eye doctor, the provider, is contracted with IMED, you can get 30% off your eyeglasses. It's a wonderful, wonderful, wonderful deal. And all you have to do is go in to the company, to the doctor, and show your ID card. You can also get 20% off on eyeglass equipment. It's a very, very, very good service. And I want to tell our members to take advantage of that. Also, we have a company called True Vision. You can save up to 40% on LASIK eye surgery at over 1,000 locations. It's called True Vision, and I hear it's a very, very, very good thing. If you want the phone number, I suggest you give me a call, and I'll be more than happy to tell you the phone number. But it's called True Vision. Then, under a company called Nation's Hearing, you can get a hearing screening, and in some service at no additional cost, you can get an in-home service. And all hearing aids start at approximately $599 only. There are many, many, many wonderful services that if you call me up at 781-963-9666, which is my home number, and you want to take advantage of all these durable medical equipment that I can give you, there's too many to give it over the computer right now. But if you call me, I will be more than happy to tell you about all these wonderful things you can get. Either non-Medicare people or people who are on Medicare. If there's any questions you want, just call anytime. I'm always here. I'm at home, and you can call me anytime you want. I'll give it back to Sean if he wants to add anything onto that.
Well, so Cheryl, a follow-up question. In addition to the, I apologize for that. In addition to the diabetic supplies, can you give some examples of what durable medical equipment is?
Of course. That's like wheelchairs, ostomy supplies, respirators, bone growth stimulators, respiratory therapy, anything, any equipment, DME equipment, even CPAP for sleeping. That's another one. These are all preferred vendors.
Okay.
And if you call me up, I'll be glad to give you the names and phone numbers of all these different things. There is also medical supplies that you can get, even home health care. If you call me, I'll tell you about it. There's just dozens and dozens of benefits and perks for our members. So just call me at any time, then I can help you.
And as Cheryl pointed out, there are really endless products and means to save money that are available, far too many for us to discuss on this video. What we will do, however, is in the email that's going to be sent to our members on Friday, and hopefully if you're watching this, you're in receipt of the email, we'll provide the telephone numbers and the company names of the major benefits that are available. But if you don't see something that you're looking for, as Cheryl said, if you are a member of Mass Retirees, you can call her, and she's more than happy to work with you on that. We also want to take a moment to remind members of a couple of other important benefits that are available or requirements that exist in terms of Medicare enrollment. Let's start with that, Cheryl. In terms of Medicare, we do get calls from members who are turning 65 or their spouse is about to turn 65 and they're wondering what they need to do. Can you walk them through that? Repeat that, please. Yep.
At a loss.
Okay.
So what I try to do is try to go with them from beginning to middle to end when they send their form in to the GIC or wherever they're going to send their form to, whatever health insurance they have. First of all, you must remember, 3 months before you turn 65, you either call Social Security and make an appointment on the phone, or sometimes they even take in people who call up, make an appointment to go into the Social Security office. And if they say to you, well, you don't have enough quarters because you didn't work enough under Social Security, you don't have 40 quarters, you remember one thing. If your spouse is going to be eligible for Social Security, you must take it. It is mandatory, because if you don't take it, you can be penalized 10% for every year over 65 you don't take it. The only difference is that you won't get a Social Security check, so you'll have to pay. Your Part A is free, it's earned. Your Part B is the one you'll have to pay quarterly. That is for your doctor's insurance. It starts at $148.50, and you'll be billed by Social Security every 3 months for it. Then, after you talk to Social Security and get everything straightened out and find out when you're going to be effective, give me a call, and I'll go through with you your enrollment form. It's on the GIC website, or 1 month before you turn 65, you will get a letter from the GIC with an enrollment form. So you can either fill it out yourself on the GIC website or wait until you get a form from the GIC. They're going to ask you what health insurance you want for your senior plan, and if you have a spouse who's also eligible for Medicare, or children. Depending on how old your wife is and your children, you could have either a senior plan for you and a family plan for your spouse and children if they are under 65. But you have to fill it out, and if you need help, remember, to fill out the enrollment form, you can call me. But you do not send the enrollment form in to the GIC or wherever you're going to send it until you get your red, white, and blue card. Because before they put you up under a senior plan, under Medicare, they have to know your Medicare number. So just wait until you get your red, white, and blue card from Social Security, get it together, and mail it in to the GIC or wherever you're going to, or whatever health insurance you have. And if you have a problem and you need my help, I'm here to help you do it from start to finish. If you don't understand, just call me anytime you want. That's about it. Just remember, you must take Medicare whether or not you're eligible, as long as your spouse is eligible. And if your spouse, if you are divorced, you have to take it if you were married at least 10 years, or if your spouse is deceased and was eligible and you were married at least 10 years, you have to take it whether you're eligible or not.
That's good information.
Is that all right, Tom?
Cheryl, but how far in advance should folks apply for Medicare, before their 65th birthday?
3 months before they're 65, they should call up Social Security, either make an appointment online, and they'll either do it online, or you can call them up and make an appointment over the phone. They will give you a date and day they will call you. You can do it over the phone. And sometimes they will even let you come in to the Social Security office. I don't know how they do it, but sometimes if you call up and make an appointment, you can go into the Social Security office and do everything there.
Okay.
And
So
they will send you a red, white, and blue card by mail.
Yep, and that's very important piece of information for our members, because as Cheryl said, under Massachusetts state law, if you are going to remain insured through the GIC or through a city or town, you must enroll in Medicare. If you do not enroll in Medicare, you'll be dropped from those plans. That's been a long-standing state law. We believe that our members who are insured through Medicare actually have a better insurance product in that it's less costly for you. Traditionally, the co-payments, the deductible, and so forth under Medicare tend to be a lot less expensive than the non-Medicare plan for really much of the exact same coverage. Now, there are always going to be some variations or differences that may exist, but you will be fully insured under Medicare. The state or the city or town will then provide the supplemental coverage for you. So you're not going to go without insurance. Your family members are not going to go without insurance if they're insured through you, just as Cheryl said. But if you need any help with applying, or you have any questions for us, reach out. This is what we're here for. We walk members through this each and every day to try to streamline the process. And as we're wrapping this up, we just want to remind folks as well, of a telehealth benefit that we are involved in, and it's really become a preferred vendor for mass retirees, and that's the IBIS telehealth system. Is provided by Sensio. They're a Massachusetts-based company. We have been working with them for going on just about a year now, and Cheryl, in fact, was one of the first enrollees in the IBIS program. And Cheryl, could you just talk a little bit about what it's all about and why you found it so useful?
Yes, I have been on the IBIS program for 8 months. And to me, it's like having a doctor in the house. I remember a couple of months ago, I took my temperature in the morning. It was very cold in the porch, and my temperature came out to 95.7. I put it down on the IBIS machine. A minute later, I got a note on the IBIS machine that's not a good temperature. Either you call us up or you take the temperature again. They're there for you if you don't feel good, if you have any health problem. If you sign up, remember it's free. Does cost you no money whatsoever for this program.
Let's see if you're a Medicare enrollee only.
As long as you're a Medicare enrollee, it costs you no money. You get you get a thermometer, you get an oxygen finger stick, you get a small computer, a tablet. It's all for nothing. If you have diabetes, they'll send you the things to do your finger blood and your blood finger in the morning. If you have high blood pressure, they'll send you the high blood pressure machine to do your pressure every day. It is just a wonderful thing. A doctor will call you, ask what your problems are, how they can help you. A woman calls me every week, Ann. She asks me how I'm doing. Do I have any problems? Would I like a doctor to call me? It's just absolutely wonderful. I do it every morning when I get up. I take it, and it's great. And there's even perks to it. If you get a certain amount of points, you get a gift card to a Stop and Shop or any one of the places you buy food. It's just a great thing.
Yeah, so you're benefiting from being proactive with your health, and the reason why we have endorsed this product and got behind it is that it's really a value added for our members. We now have well over 100 members who are participating. It's not for everybody, but for those who want to be more proactive and have really a second set of eyes and ears when it comes to their health, particularly right now with the COVID-19 pandemic, continuing. It's just one way for people to really provide peace of mind and identify any type of health problems that may be existing, as well as as a reminder to engage in the daily activities, whether it's taking your blood pressure or checking your blood sugar, taking your medications, all those sorts of things. It's really been invaluable for folks. So Cheryl, thank you for sharing your experience.
Okay, could I say just one more thing, Sean? Yeah. I want to tell our members, please, if you look on TV and you see a prescription drug plan that's no cost or cheap, do not ever take a prescription drug plan other than the Silver Script plan you have. If you do, you will lose all your health insurance, and you will not be able to get back under the health plan, until you get a letter from the pharmacy where you took this prescription drug plan, and they tell you that it's ended and the month it's ended. Remember, you see something on the TV and it looks good, it usually isn't. So just think about that.
Yeah, it brings me back to what my mother always used to say of, if something seems too good to be true, it most likely is. And you need to be very, very careful in whatever you do. Don't drop your state or your local health insurance to pick up one of these lower cost plans. It's really buyer beware. If you see something or if you get a solicitation and you're not sure, again, reach out to us. This is why we're here. But this has gone on a little bit longer than we normally do, but it's really important information. Cheryl, thank you for joining me this afternoon.
Thank you, Sean, for having me.
You're welcome. We're going to have more of these types of discussions over the coming weeks. Right now is the time of year when there's a lot of focus on healthcare benefits, both at the state and the local level. So we want to make sure that we're getting all of that information to you in a way that's easy for everyone to understand and you can plan accordingly. So with that, thank you so much for tuning in again this week, and we'll be back to you again next Friday with the latest update. Thanks.
Thank you very much, Sean. Bye-bye.